Okay, I think we're live now. Welcome everybody. My name is Elena Andrioni. I'm the Community Outreach Liaison for Fleming Therapy Services. And today we wanted you guys to be able to meet our wonderful Glen Allen team. So I'm going to kick it off and start with Caitlyn. If you can go ahead and introduce yourself, Caitlyn, what your discipline is, where you went to school.
I'm Caitlyn Beam. I'm a physical therapist here at Glen Allen. I'm also the center manager here at Glen Allen. And I went to Wheeling Jesuit University in Wheeling, West Virginia.
Awesome. And what about you, Peyton?
My name is Peyton Yates. I'm a speech pathologist here, and I went to Longwood University, which is not too far away from here.
And I'm Laura. I went to Liberty University for undergrad, and then for grad school, I went to Virginia Commonwealth University, and I'm the occupational therapist here in Glen Allen.
Great. So now that you guys know who everybody is, let's start with Peyton. Why did you choose being a speech therapist, and what do you love about working with kids?
So I chose to be a speech therapist to help kids communicate better. So whether it's that they can't say their R sound or that they don't have enough words, I mean, they're 2 years old, or maybe they have a stutter, just really helping them communicate their wants and needs, whether they're at school or at home or just hanging out with friends. And I think working here at Fleming, just being able to work with a bunch of different areas. So I feel like it's very diverse. So you see something new kind of every single day. So definitely never bored.
No, that's definitely true. What about you, Laura?
I chose occupational therapy. Actually, I have several OTs in my family and tried to stay away from OT for the longest time because I didn't just want to do what everyone else was doing. But my mom encouraged me to really get involved and observe and just see what it was all about. And I found out that I loved it. And the first setting I observed in was pediatrics. So I've observed and worked in some adults too. But I love pediatrics because you never know what's going to motivate a kid. You get to be super creative. You get to play all day. There's a lot more science behind it than that, but it's really fun. And you get to really find those things that kids love and what motivates them and use that creatively to help them be more successful. And I love getting to use my brain in that way and my creativity like that.
And I think that's a good point too, right? Because with kids, it's always different. You could see the same kid twice a week for, a month, and they're going to surprise you every single time. Something that worked last time isn't going to work the next time. So the fact that you guys can be so flexible, it really is like working with a different group of people every day. So it's exciting. Kids will definitely keep you on your toes.
Absolutely.
What about you, Caitlyn? Why do you like peds, and why do you choose to be a physical therapist?
I chose PT because I really wanted to do something in the medical field, just didn't know what. And I had a great opportunity to shadow at a pediatric hospital that's probably one of the best in the country. And while I was there, it was just like a opening gate to just be like, this is what I'm supposed to do. I just absolutely fell in love with it. And through PT school, that was the reason I got through PT school, was just keep remembering exactly what I saw, because I knew I wanted to do that. And working in peds, it's so rewarding, but so difficult at the same time. And I love the challenge, but the reward outweighs every challenge that you ever put up with. And it's just so different because you can use your creativity. You have to be on your best behavior / best role model that you can be to kind of help that kid. And like Laura said, it's a fun way to play all day, but it's a challenging way to play. And I love the challenge of not seeing the same thing over and over again, even when you see the same kid, maybe over and over again. And the progress is just amazing.
Yeah. Would you say that there's like a certain diagnosis or a certain age group of kids that you really are drawn to working with, or that, yeah?
Yeah, I think when I first started my career was really geared toward behavioral modification because that was my undergrad focus, and development. I love development. So it started usually with the kids on the autism spectrum. I saw a lot of kids with, ASD. I love that patient population. As I've kind of moved into my career, I would say that birth to 3 has kind of been my jam. I really love those hands-on babies and the family progress that you see, as well as just like building those developmental skills. But that doesn't say I don't love like an orthopedic patient too. They're fun to get back to sport. I also really love the heavy neurological disorders. I think they're fun too because the progress is so different and their functional limitations are different than, a atypical child with just an orthopedic kind of condition. So those are kind of my areas of like, I would say.
And I think one of the best parts, at least for me as a parent who brings their kids to Fleming, is the possibility of being able to have my children see two therapists at the same time, right? Doing those co-treats and the fact that we have all these disciplines in one center. I mean, it's huge that we can have, like you're saying, Caitlyn, maybe those kids that have, a heavier neurological disability, maybe they need speech in there at the same time, or they need OT. Laura, have you had an opportunity to do co-treats? Is that something that you like to do? And then what particular diagnosis, similar as Caitlyn, what age group do you really like working with?
Yeah, so I've had the opportunity to do a lot of co-treats. Usually it's with speech, and I love it because I feel like we really get like maximum efficiency out of the session because you're having two people and two disciplines coming together and working on both things at the same time. So whereas spending 2 hours separately, you can spend 1 hour and work on it together. And it also helps us as therapists learn more about the other disciplines too. Our motto is therapies in sync. So in order to truly do that, we have to have that knowledge of what other disciplines may be working on. So even when we're not co-treating, we can still be targeting those things and helping each other out and making sure that we're being consistent, even if the other therapist isn't present in the room. So I think it's good for both the kids and for us. And as far as a certain age group, I don't know, there's pros to both. Like I love the younger kids because there's such like, I don't know, imaginative and like the magic of a new toy. And you kind of get to watch that. But then the older kids, it's so fun I'm very personable and conversational. So I love being able to just like hang out with them and talk about our days. And there's benefits to that too. In undergrad, I spent a lot of time nannying for a little boy with Down syndrome. And so Down syndrome has always had my heart and I love working with them and just the general strengthening but I also love orthopedics. Like I said, my mom, she's a hand therapist, so it's really fun to like bounce ideas off of her and talk about splinting and just really broaden my knowledge of that too.
Yeah, I think that's great. Shout out to your mom too if she's watching us. Peyton, what about you?
Yeah, so I think probably the early language kiddos are my favorite to work with. Before coming to Fleming, I hadn't had too much experience with them, so I was a little bit intimidated, but actually coming in here and working with them, they've quickly grown to be some of my favorites. And then with co-treats, I feel like I learn something new every single time we do a co-treat, which is awesome. I feel like before in jobs, we didn't have as many co-treats, so it's really interesting to see how we all work together and how much it benefits the kids and how much they respond to it.
Yeah, they do. And I think that just in getting to observe you guys do co-treats, just seeing like you play off of each other and see what works for them and maybe what works when there's two of you in the room that wouldn't have worked with one of you. I think that that's huge too. All of a sudden you're like, wait a minute, Johnny didn't do that for me last time. How did you get him to do that? And then you can take that back to the session too. I think that's a really great option for families that they may not get in other clinics. So I love that that's an option here. So, Caitlyn, what can we find you doing outside of Fleming? What are you passionate about outside of Fleming? I know you love working with kids. I know you love working with, Peds. So, what do you do outside of us?
So most of the time you can probably find me at home with the dogs. I have two big dogs that spend up most of my time. We do a lot of hiking, a lot of swimming, like to go down to the river. I'm also really big on the game of golf. I also love pickleball. So those two games, you might find me maybe out on the golf course or playing pickleball with some friends, just to get outside.
That's interesting. I've known you for a while and I didn't know you liked pickleball. So that's interesting. What about you, Laura? What do you like to do?
So I actually, before I started working with Fleming, I was a music teacher, mainly piano. And so you can find me working with kids again outside of Fleming. And I love using my OT knowledge with that as well. It's really fun. Also, my husband is a big outdoorsman. So we love to fish, we love to hunt, we love to go camping, just spending time outside or we just got a grill this weekend, so grilling out on our back porch is something we enjoy doing. And I don't know, I'm a big people person, so hanging out with people, grabbing dinner, just spending time, that's a way I kind of unwind from the day.
What about you, Peyton?
So kind of similar to Caitlyn, I have a new-ish puppy. He's 6 months old. He's kind of crazy. He eats my shoes all the time. But I also enjoy playing tennis, and then we just moved, so we have a backyard now, which is exciting. So I'm trying to get into gardening. It's a work in progress.
That's very exciting. And you guys are all local in the Richmond area too. I think that's great too, because you can connect with the families and give them ideas for like community events. I know that there are companies that offer special programs for kids with Down syndrome, or special programs with kids with ASD, for gymnastics or swimming or all sorts of different things. So the fact that you guys are local to the community too, I think is huge, that you're able to bring your knowledge of it into the center and then offer those ideas for the families as well. Do you guys have anything you want to ask each other question wise? Learn more about you guys that way? I know I'm putting you on the spot.
I'll go first. I think that this is such a great team atmosphere that we have between the three of us. So between the two of you, what do you guys feel like in the past few months, just getting to work together even more now that we're kind of doing more co-treats? What have you learned the most in the past couple months? Whoever wants to go.
That's a really good question. I think like in my fieldwork experiences and before this, I had some co-treats, but not as much. And it wasn't as much of that collaborative model that we have here. And I think, Caitlyn, you were saying the other day just about how important it is to have that knowledge of other disciplines so we can carry it over. Even having that knowledge of what Peyton's working on in speech, when I'm treating a kid, I can work on those things too and address those so things are consistent and we're getting the most carryover possible. And so I've really enjoyed just learning from you guys, just the basics of your disciplines. And even learning, like I had a chat with Peyton the other day talking about what should I be looking for as I'm working with a kid to know should I refer to speech or not. And just knowing those basics too, so we can really provide the best services to our kiddos and their families.
Mm-hmm.
Yeah, I definitely agree with Laura on all of that. All of the basics, and then also just something as simple as like how they should be like sitting during my session if I have them at a table, or how they should be like holding their pencil at the table. There are so many things that I feel like we've learned. And then even like maybe if there is an unexpected situation, seeing how you guys respond to it. I feel like that's very helpful to see, and like how we talk to parents. There are so many things. I think I could go on and on.
What is something that you would like parents to know about your discipline, that, or parents or doctors or anyone that might not think that you guys can work with? So like, I think that for me, before working for Fleming, the speech therapists and occupational therapists can do so many things, right? It's just amazing. Like, besides just helping a child learn to speak, there's just so many different things that you guys can work on. Is there something that you would like people to know that, oh, we can help with this, that maybe they wouldn't have thought of?
For OT, I would say, I don't know, I feel like when people think of pediatric OT, they think helping a kid get dressed, or they think like sensory concerns, like my kid doesn't like their hands to get messy, things like that. And I often see parents are surprised when I say we can work on attention, we can work on behavior, we can work on all those things. We can work on play skills, sharing, interactions, like social participation. There's so many things, because, you know, as OT, we define occupations as anything someone does throughout their day. So for a kid, that involves a lot of play. And so I think those are things that parents are often surprised that we can work on. And those are actually really fun things to work on for us. We love getting to teach them how to share, how to take turns. So I really enjoy when I get a kiddo I get to work on those things with.
And I think that this is a great space for them to figure out those skills too, especially coming hopefully out of COVID. We're seeing a lot of kids that maybe didn't get to practice those skills in preschool or daycare or things like that. And we're the right place to say the wrong thing and do the wrong thing because we're just going to keep moving and we're going to learn how we should do it, what is expected in those certain situations. So, yeah, I think that's a great point, Laura.
From a PT standpoint, I think sometimes it's oftentimes just like, oh, you're going to help my kid walk and help my kid meet developmental milestones, right? It's like, that's the big thing with PT. But the bigger thing, especially for kids that, maybe just have trouble with coordination, right? They can't keep up with their peers, or PE is hard for them because we can't skip, we can't hop, we can't do these things that take maybe a little bit more coordination and more strength to do, but we're not quite sure if they can or can't do it because they don't practice it enough. We can really provide that input to the family to say like, yeah, they do need a little bit of help, or they need some strengthening in these areas, or no, they're on track for that. And it's going to take some more practice and some more time. I think those are the kids that I kind of enjoy working with sometimes because they do want to keep up with peers. They don't want to be the kid in PE that's not picked. And hopefully we can help them be that kid that has a little bit more coordination and feels more confident in their skills.
Yeah. And I think it's good too, because parents don't always know. I mean, I know that when I think back to when my kids were young, I didn't know what they were supposed to do. Dr. Google told me, oh, when they were supposed to do this and this. And you just made me think of a good point, Caitlyn. And Laura, you can probably talk to this too. Can you just touch on the importance of crawling? Because I think that as a mom, if my 10-month-old just took off walking, I would just be like, yes, this is great. We're mastering this milestone. But I think that parents don't know how important crawling is. So I just wanted to bring that up too, because I definitely didn't know.
Yeah, I think it starts with PT, right? Then it leads to Laura. So PT, we're working on the skill and it's made for a purpose. We have developmental positions for a purpose. And the purpose is usually from a PT standpoint to build strength, whether it's more close to our inner core of our body or more distally into our hands, into our feet. But crawling is important because it provides that stability for a child to transition out of other positions. Right. We get off the floor quickly by crawling to something. That's the next developmental stage. We, move on the floor with a crawl. And, a lot of people say, well, they skipped crawling. They probably didn't skip it. They probably just didn't do it long enough. Mm-hmm. But what we see from a PT standpoint is that they have trouble with walking or other skills because they never developed that core strength or that core stability to be able to do single leg balance or running with good trunk rotation or skipping with coordinated movements because they just didn't get it. But then it also affects OT for a lot of different other reasons.
Yeah, so I totally agree with Caitlyn, and I would also add on with the strength part. A lot of goals that we have for our kiddos are often like maintaining positions like prone, which is just your hands on the ground, you're on your belly. And a big part of that has to do with that core strength and that upper body strengthening as well. And crawling is a time when you develop a lot of that strength. I would also touch on the coordination piece too. I think a lot of times we think coordination like left side and right side of the body, but you also have to think the top part of the body and the bottom part of the body too. And we forget that aspect of coordination sometimes. And that's a part that happens with crawling too, coordinating your upper body and lower body. And then I also think, you're using your hands, you're feeling different textures with your hands on the ground. So it's part of that sensory development as well, and that tactile input that you're getting.
Yeah, and if you think like you're not crawling around, you're not touching things and feeling the different surfaces, and then that might lead into feeding issues down the line where you're just not gonna, want to try different foods because you're not used to using your hands to feel those different substances.
Absolutely.
We are huge proponents of messy play. Let your kids get messy, let them get dirty, and let them use their fingers and their mouths to explore certain things. And then similarly to that, I'm using my own experience here, but Peyton, what would you say for families that they have a child who's not talking yet? What are some things that they can do to help promote early language at home? And then at what age do you think that we'd like to see them hear? Which again is no fault of the parents or anyone. It's just sometimes kids need a little extra help in all these areas, and we're here to play, so they're definitely gonna have fun.
Great. So if a kid's not talking yet, we do a lot of multimodal communication. So that could be them signing. So we do a lot of like more all done, please, so they can request and protest, kind of tell us what they want, what they don't want, and then accompanying that with the verbal part of it too. So with speech, we like to talk about everything we're doing while we're doing it during play. So if we're stacking blocks, we're talking about stacking blocks. If we're playing with farm animals, we're talking about those farm animals. We're really labeling everything and putting a word to everything.
Right. So really just encouraging parents to just talk nonstop and label throughout the
Mm-hmm.
day. And if they're already watching and they have that 2-year-old or that 3-year-old that's just not getting it yet, I want to let you know that I was there and they get it. And then someday you're going to go back to your speech therapist and say, wow, you were right. Now they don't stop talking. So
Mm-hmm.
it's definitely, some kids just take a little bit longer, but we're happy to help in any way possible. Is there anything else about your discipline or about working with Fleming that you guys want everyone to know?
I just think here at Glen Allen, our team is fantastic. We're really working with each other day in and day out. And we have a huge collaborative model. That's not just here at Glen Allen, that's at across Fleming offices.
Yeah.
We have a great network of people that we can bounce ideas off of, help families. Maybe it's not an area of our expertise, but we are here to learn and try to help as much as we can because we have a great network to do it in. And I think our model is so fantastic. Laura touched on it before, that in-sync therapy is so important. We can only start at the beginning. You know, if we want to work with the developmental skills and they can't sit up, then we know that there's probably going to be a speech delay too. So how can I prevent that from happening? So working together, kind of helping each other out it's a great component to our staff and to our team.
Yeah, I think that's a great point too. And I know for me, I can speak to all of you because you've all seen my kids and you really are the best. So for any other families watching, you're going to get the best care possible at all of our Fleming offices, but definitely here in the Glen Allen team as well. They're a great group of ladies. And they really care about them. I mean, I don't know how many times I've gotten a text from Caitlyn on a Saturday saying, try this with with your daughter on this and this. And I'm like, you shouldn't be working, but you're always thinking about these kids and coming up with so many creative things that keep it fun for them. They love coming to here to play. So it's awesome. So thank you guys so much for everything that you guys are doing and for taking the time to talk today. I really appreciate it.
Thanks, Elena.
Jason, do we have any